Many people feel exhausted and have concentration problems regularly, and these are only some of the symptoms of chronic fatigue that millions of people live with every day. 11 News reporter Juliana Collado tells us what you need to know about this disease.
Jamie Kelly is a BYU student whose little sister JAELA suffers from chronic fatigue. Doctors have now changed the classification of the energy-sucking syndrome to a disease after evidence showing it is a physical illness. Jamie is worried because she says JAELA's life is limited by her disease. She's tired all the time.
She doesn't look like she's having a hard time, and so everybody else expects her to be able to keep up and do everything, and sometimes they'll think that she's just faking it.
Chronic fatigue syndrome has no known cause, but affects almost 2 million people in the U.S. Jamie and her family are not the only ones affected by chronic fatigue. People are learning more about it, and there are some institutions that are implementing health programs for those affected by chronic diseases. BYU is one school that helps students with chronic disease and disabilities. Tyler BRIGGS works for the Accessibility Center and has experience dealing with this newly classified disease.
Rather, I've seen studies showing that there may be some psychological factors involved, like stress or anxiety.
Tyler says people can go to the doctor when they feel any symptoms. He encourages students to visit the center if the disease is confirmed. In Provo, Juliana Collado, 11 News.
Experts say if you have fatigue, loss of memory or concentration, unexplained muscle pain, or extreme exhaustion that lasts more than 24 hours after exercising, you should talk to your doctor.